Dr. Bijlani at AIIMS with his team has shown that it can reduce the risk factors for cardiovascular disease and diabetes. Similarly, immense amount of research showing the role of yoga in prevention and management. And I must at this point make a statement. Yoga has a lot of potential in prevention that has not been tapped yet. What we are tapping is the adjuvant potential of yoga along with other systems. But we need to also look at the preventive potential of yoga a bit more. It has been suggested that being safe, simple and economical, especially in our country, we cannot keep on increasing our healthcare budget. And what happens is when you use adjunct yoga therapy, this is what we have seen in our own work, you can obtain the benefits at lower doses, reducing side effects of the medicines, enhancing metabolic control and patient compliance. Why do our patients stop taking the medicine? Two factors, cost and side effects. If you can reduce the cost, if you can reduce the side effect by adding yoga to the modern medical management, definitely the patient compliance to the modern medical management will also be enhanced. Overall benefits are going to be there. So this is something that I often tell the drug companies when they come to me, and I tell them that we need to not just look at yoga as something that is a competitor to you, but please understand we are friends and maybe you guys should sponsor some of our yoga research also. Going on, there has been a lot of work showing some of these aspects and what we need to focus on. Earlier, the yoga people used to say, oh, you do this asana, it presses the pancreas, there's more insulin. And now we realize that is not what is happening. What is happening is that we are enhancing the insulin sensitivity. And we need to refocus the way we have been exploring these mechanisms. And again, a systematic review has shown that reducing weight, blood pressure, glucose level and high cholesterol, which I'm going to mention in a few minutes with regard to metabolic control syndrome. Nerve conduction, biochemical profile, again, as our keynote speaker so beautifully told us this morning, the complications, we need to start looking at that side also, not just the disease, but what are the target organ damage that is happening, the end stage issues that are happening in diabetes. Can we work on that before? And while I'm talking about that, I think somebody needs to reconnect the laptop. It's gone off power. I'll continue talking, but please get that worked out. Now, coming back to this, we are looking at yoga as just a system of exercise. Yoga is not just a system of exercise, it is a way of life that includes how you think, how you emote, how you rest, and what you do with your life. So it is every moment conscious living, which is why Sri Aurobindo so beautifully said, all life is yoga and every moment of life has to be yoga. We have the concept in yoga of Ashtanga Yoga given by Maharishi Patanjali, where he gives yama and niyama, which are basically how you deal with your social connections, how you deal with your relationships. What are the subhuman tendencies you have that need to be kept in control? What are the humane qualities that need to be developed and enhanced? So the yama niyama are vital when we want to work on what is called social health. We all know the World Health Organization's definition that health is a state of well-being that is at the physical, the mental, the social and the spiritual levels. We keep on forgetting the spiritual, though it has been in the definition for many years by now. Now the first two aspects of Ashtanga Yoga, the yama niyama, they are enabling social health to occur. You have better relationships. Now it is in the relationships that we have the maximum stress. Often my father used to say, he said, if you feel you are perfect, if you think you are perfect, just get married. And he said, the moment you do that, you will have someone with you your whole life to tell you you are not. Now one of my students in the UK, when I was lecturing last month, she said, Dr. Ananda, I will add to it. If you think your marriage is perfect, have kids. And I think this is very important to understand that our relationships are often a great source of stress. So if we are not dealing on relationships, which is social health, with ourselves, with immediate family, with our society, that stress that is going to come in is going to aggravate whatever disease progress is happening. Either stress is going to precipitate, aggravate, or it is going to induce someone who doesn't have the disease to have it. Now people often come to me and say, Dr. Ananda, my genetic structure is of diabetes. My father had it, my grandfather had it, my great-grandfather had it. And I like to tell them, my professor of medicine at JIPMER, Dr. A.K. Das, he used to say, your genetics are like a loaded gun. Your genetics are like a loaded gun. Whether the gun goes off or not depends on you pulling the trigger. Who is it that is pulling the trigger? We. How? By our thoughts, by our actions, by our diet, by our lifestyle. If you can call it a lifestyle, I say there's no style in it at all. So what is important is, if we are going to understand yoga as a lifestyle, yoga as a therapy, we have to start from the fundamentals, which is the yama niyama, giving the proper attitudes. Then you come on to the second part. The second part is the asana pranayama, which is how we perceive yoga. You talk about yoga, immediately people think of asana pranayama. In fact, many people, they forget that pranayama is part of yoga, and they say yoga and pranayama. I say, please remember, meditation is part of yoga, pranayama is part of yoga, so let's not separate them. There itself we create divisiveness. So coming back here, the asana and pranayama enable us to be at the level of physical fitness that we can be in this body. Each of us has our own unique genetic structure. So we will have certain weaknesses, certain strengths, certain limitations. But what yoga is helping, especially the asana pranayama physical practice, keep your body as physically fit as you can given your genetic structure and the environment in which you live. Then comes the next part, the mental health. The mental health is facilitated when you can control your senses. Your senses that are going out, normally they are bahya mukha. They are all bahira mukha. They are always going out. You bring them and bring them into antara mukha. You bring them inward facing. And at that point, senses that are going out are brought in. It is called pratyahara. And that enables you then to start concentrating. People want to jump to meditation. They cannot first concentrate in the first place. Concentration is facilitated by pratyahara, that is facilitated by pranayama. Patanjali tells us, dharanasucha yogyata manasaha. Your manas gets yogyata, fitness, for dharana, which is the first point of going in. So that concentrative practices of dharana and pratyahara give you the mental fitness, the mental health, the mental well-being. And then come the last two limbs, which are the dhyana and samadhi, that enable spiritual well-being to manifest fully. When you can go beyond your limited individuality. We are all stuck with our individuality. I am so and so, I know this much, I have achieved this much. We have all of this within us. And that is why in your keynote, sir, so beautifully you put it. We need to let go of that. The most telltale sign of greatness is humility. Because it is, you start to realize, as in Tamil, Abhaya, our Tamil Mudati Abhaya says, Katrathu kaiman alavu, kalladadu ulagalavu. What you know is in one fist. What you don't know is the whole world. That gives spiritual health. When you start to realize what you know and what you don't know, and that automatically gives that sense of well-being. So the concepts of Ashtanga Yoga we are bringing into the management. Now, how is that happening? That is happening, and I'm going to rush through a few of these slides because I've gone on to the yoga component, by, I think this is where we were before this. Will this work now or not? Fine. While we are on that, let me go there. Now, I was talking about, rather than talking about diabetes, I wanted to also bring in metabolic syndrome, because metabolic syndrome is the modern pandemic. And in India, we are sitting on a big bomb, a time bomb that is just ready to burst any time. Because if you look at this, out of the 5 components that they talk about in metabolic syndrome, they say if you have 3, you have metabolic syndrome. Most people already have diabetes and hypertension, not just hyperglycemia and pre-hypertension. They are already receiving medicines. So we already are stuck with that. And when we look at this list, we start to realize that, oh my God, we need to change, and not only change, but change fast. This is one of the biggest issues. We have this concept of Amul baby. Oh, my baby is very chubby. And you keep on feeding that baby, and that is where obesity starts young. One of the most important aspects that then gives us the problem. And again, for the young people here, if you eat junk food, you just end up becoming junk. There's no way you can put junk food inside and remain healthy. Our systems are not made for that. So we need to start looking at that. Eat healthy to be healthy. And these are some concepts that are now coming in. What is it that we are giving the kids for snacks? What is the lifestyle we are giving on the kids? Kids are having books in the back that will kill anybody. And as some of my students from New Zealand, after looking at my kids' school bag, they said this would be labeled a health hazard in any other country, the size of that bag. And then how are we expecting them to be healthy? And again, one more point which I really like to bring out here, because we keep on forgetting responsibility for our health starts with us. And what we are telling people, you eat anything you want, you do anything you want, just take your medication. I think we have to be very careful with this, because we are taking the power, we are disempowering the individual, rather than say start to make healthy lifestyle changes plus your medication. This is where we need to start to go, because we are actually really struggling. And that is why when we come to yoga, as I said, the Ashtanga yoga is not definitely this type of yoga that you are seeing nowadays. You have, this is the image, or now you have goat yoga with also bear yoga and this type of thing. This is not what we are talking about when we talk about yoga at all. And as I said, the different aspects, social, physical, mental and spiritual health, which I've already talked about. So what is yoga therapy? The International Association of Yoga Therapists gives a beautiful definition that it is the process of empowering the individual. So you empower the individual to progress towards improved health and well-being by applying the teachings and practices of yoga. Not just the asana pranayama, what are the teachings, what are the concepts? Those are very important. So when we are working through yoga therapy, we are looking at normalizing body weight, adiposity, blood pressure, blood sugar, lipid profile, and importantly, autonomic balance that we can measure through sympathovagal balance and HRV, etc. Enhancing the quality of life. It is not enough if somebody's blood sugar is normal and the blood pressure is normal. Do they feel healthy? Do they have a sense of sukham, or are they not healthy? And again, reducing the insulin resistance, which is one of the key components we are trying to work on, and mechanisms, decreasing sympathetic activity, enhancing parasympathetic, and working on these aspects by different practices, starting with diet. Yoga starts with diet. Simple movements, actions, Surya Namaskar, twisting poses done from different positions, standing, sitting, the cleansing practices, pranayama, relaxation, and meditation. All of these are components. And as someone said this morning already, but I'm going to repeat here, normally we talk of achar, vichar, ahar, vihar. We forget the healthy relationships that are very important if you want to maintain and sustain health. Now the whole basis of how yoga works is that it works counter to the stress response. I don't like to call it stress response, I say it is a stress reaction. Response implies you do something from the prefrontal cortex. But this whole thing is, the prefrontal cortex is the last thing to come into it. So though we technically call it the stress response, I say it is more of a reaction. The response part and the responsibility part is very much missing. Now this was fine when we were being chased by a saber-toothed tiger to have the fight and flight response. And what I would like to just point out here, especially to the young people, the whole stress response that comes in starts with perception of stress. Perception of the stress is where the whole response kicks in. Now if you modify your perception of the stress response doesn't kick in. And that is why I would like to point out to you, nothing can stress you if you don't let it stress you. You have the power, and the power is the prefrontal cortex, where in yoga we talk about the buddhi, we talk about the intellect, we talk about the Viveka and we talk about the Vairagya. That discrimination or discernment that can understand what to do. The whole response then comes in, but working on the response after it has come in is like a dam has burst and you have tissue paper and you are trying to fill it. Now when the moment the dam becomes weak, if you start to work on it, you can prevent the damage from happening later. Now, a very beautiful concept of seletogenesis from Antonovsky is the stressor is there. Everyone has stress. The only people who don't have stress are the dead people. Once they die, they don't have stress. The people left behind have the stress. So if you say you don't have stress, basically you're not living, because every moment there's a stress. That is what life is to be. It is to enhance you. So Antonovsky has made a beautiful statement. He says the stressor creates the tension. If you deal with it in a salutogenous manner, you say, this is an opportunity for me to do something. This is an opportunity for me to change. You go towards positive health, H+. But if you say, oh my God, this is so bad, my society is bad, my family is bad, my doctor is bad, everything is bad, you go down the pathogenic and go into the breakdown. Who makes the decision? We. And that is what yoga says. You are responsible for your own health and happiness. And this is very much brought in by the understanding of the psychoneuroendocrinology and psychoneuroimmunology these days, that the stress is bringing in the negative aspects, whereas what we are trying to do through yoga, induce the relaxation response. You can consciously induce a relaxation response. Beautiful documentation by Benson and his work in the USA. Again, we need them to validate and then we are happy about it. I was so happy today to learn about Indian scientists, because that is what we should follow, not we are waiting for Harvard Medical School to say yoga is good. And that is why what we need to understand here is stress and relaxation. This is the key that yoga is working on, not the other aspects. If you can induce relaxation, you will facilitate healing, because nobody can heal when they are stressed. I repeat that. Nobody can heal when they are stressed. They will only heal when they are relaxed. It is the parasympathetic anabolic system that enables you to heal, and unless and until you can bring the relaxation response for the patient, healing is not going to occur, or is going to be delayed. And again, illness to wellness, what is the difference? When I say it is me, illness, when I say it is we, and I start opening my mind a bit more to other people, we go towards wellness. Here the main issue that I often find is the patients identify with the disease. They come into our clinic in the hospital and I say, who are you? And they say, I am a diabetic. I say, who are you? They say, I am a hypertensive. Who are you? I am a cancer patient. I am like, at least say your name. You have identified with your disease so much that your identity is now as a diabetic. Your identity is as a hypertensive. Now, when somebody identifies with something, it is very difficult to get them to detach from it. Lord Krishna in the Bhagavad Gita says, Dukkha Samyoga Viyogam Yoga Sangitam. Yoga is the detachment from our tendency to go and catch hold of suffering. Dukkha Samyoga Viyogam, the one place where yoga is defined as disunion. And we have to help the person. I say the diabetes. Don't say my diabetes. My diabetes, my hypertension, my cancer. You are claiming ownership. And from the days of Mahabharata, nobody will give away any property. Even one small needle also Duryodhana didn't want to give. Once you say it is my diabetes, do you really subconsciously want to get rid of it? When you say it is my hypertension, how are you going to deal with it? So say the hypertension, the diabetes. Create a small gap and remember it is an unwelcome visitor that you want to get out of your house as soon as possible. That is one of the important changes that has to happen. And research has shown us that in the entire stress cascade, at every point in the stress cascade, you see those small asterisks. Those are places where there is documentary evidence that yoga can work. So throughout the stress cascade, you find opportunities for yoga to work against the stress-induced psychosomatic lifestyle disorders. So we are having evidence. I think the main thing is, can we bring about the change? And Dr. Selvamurthy from DIPAS and retired as the head of DRDO, he made a beautiful lecture at our college and he said, yoga enables and empowers the individual to modify the perception of the stressor, optimize the response to them, and efficiently release the pent-up stress. So a 3-in-1 action, we always want this 3-in-1 action in everything. So you can say yoga, anti-stress is a 3-in-1 action. Beautiful documentation that you can find on the net also, Ines and Vincent, showing beautiful mechanisms by which yoga is working. We are understanding it physiologically, biochemically, going down to the molecular level also these days. But ultimately, what is it that is helping? When you integrate the breath pattern with the coordinated smooth body movement, when I lift my hands, I just lifting it, lowering it is PT exercise. But the moment I say I'm breathing and lifting, what am I doing? I'm bringing body and mind together. I am creating psychosomatic harmony. Whether I'm lifting my leg or lifting my hand, it doesn't matter. If I am doing the movement with breathing and mindfulness, mind, breath, body movement, they come together and automatically all of these benefits are coming. This is why we had this beautiful program, and I was part of it, where we had this national program for diabetes headed by Dr. Nagendra ji, and some very good results. More than 2.5 lakhs people were screened for it, and some changes have definitely been seen in that. And this is why, if you look at how you want to work on it, you have to work on diet. Similarly, the different type of yoga practices, there's a huge list of practices. I'm not going to go into each one, but all of these practices, they are modified as per the individual's capacity. So what is in the picture is only the model. Each person, they do to their best effort. And the best effort made by the person gives the best benefits. Again, we do with the pranayamas, especially the left nostril breathing, which is found to be sympatholytic and parasympathomimetic. So again, relaxation response, anti-stress effect, we have been documenting with that. Again, throwing away the tensions, and I will just request you all to join me for this. Can I request you to just stand up, humor me for 5 more minutes, and we will end. Can we just shake our right hand? We have been sitting since the morning. There are a lot of tensions and stresses. Can we shake? Beautiful, beautiful. Now your left hand. Do we know right and left? Let us check out, do we know right and left? Now both the hands, give a nice shake. Now as you shake, the whole body gets a nice shake. Excellent shake, beautiful. Loosening up all the tensions. Now shake as fast as possible, as fast as possible. Huh? Cleaning up all the tensions. Now catch hold of all the stresses you can think of. Catch hold of it tightly, take in a deep breath, and throw it away. Oh my God, you don't want to throw away. Remember, don't attach to your suffering. Dukkha samyoga, we don't want viyogam. Let's shake again, a nice shake. Good shake. When you do this automatically, you're all smiling. The moment you smile, you have serotonin being secreted, feel good hormones, endorphins, enkephalins. Now as fast as possible. Fast, 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 fast. Beautiful, beautiful, beautiful. Catch hold of all your tension, tight, tight, take in a deep breath, and throw it out. Now, again to enhance feeling good, put your hands on your abdomen, and we are going to make a sound which is ha, 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 ha. Okay? When you laugh, when you let this is your solar plexus, this is your psychic umbilical cord connecting you with the universe. When you are reconnected with the universe, you are at ease. You are in your sukha sthanam, and at that point you are going to be much more healthy. So without taking too much more time, I will thank you very much for this opportunity so that others can go on. There are a few more things. This will be on SlideShare. There are a lot of videos and aspects there that I'll come to it. But just to end with my father's statement, my father Swami Geetananda Giri made a beautiful statement. Health and happiness are your birthright. Learn and live yoga, for then you will know true health and happiness. I think this is so important. We need to take responsibility for our own happiness and health, and may we all do that. And that is my prayer, that may we all find that Sukhasthanam and enable others to find that Sukhasthanam. Hari Om Tat Sat. Thank you.